Norwood, Ohio. He's the father of 12 children, 31 grandchildren, and 5 great-grandchildren. His beloved wife, Shirley, passed away on Christmas Day of 2005. Dr. Byrne completed his undergraduate work, receiving his Bachelor of Science degree from Xavier University in Cincinnati, Ohio in 1953. He went on to medical school, to St. Louis University Medical School, completed his work there in 1957. He faithfully served in private practice in pediatrics and neonatology since 1961. He is the founder and director of the Neonatal Intensive Care Unit in the Cardinal Glennon Memorial Hospital for Children in St. Louis, Missouri, from 1963 to 1980. Dr. Byrne is also a pioneer in neonatology, the therapy for newly born. He worked with the electronic engineers of the space program to adapt the blood pressure device that they used for the astronauts. It was something that they placed on the astronaut's finger to monitor their blood pressure. He said, why can't we apply this to the premature or the newly born? And so they developed a monitor system which would monitor the blood pressure of these premature born babies. And this greatly reduced the mortality rate of these premature babies. And it opened the way to several other advances in the technology of neonatology. For this and related new therapies for infants, he was listed in Advances in Medicine in the 1973 annual edition of the Encyclopedia Americana. He has held numerous teaching positions: clinical professor of pediatrics at St. Louis University, Creighton University Medical School, Oral Roberts University, and Dr. Byrne is presently clinical professor of pediatrics at the University of Toledo, College of Medicine in Toledo, Ohio. He's held this position since 1996. He's also the director of pediatrics and neonatology at St. Charles Mercy Hospital in Oregon, Ohio. He is a member of the Catholic Medical Association and held many positions in that association, including president of the Catholic Medical Association from 1997 to 1998. He is a member of many other medical associations and societies. We can't list them all right now, but this includes the American Academy of Pediatrics and Fellowship of Catholic Scholars. As an expert in his field, he has done all in his power to defend the right to life from the moment of conception to natural death. That's been his apostolate for many, many years. We can be very, very grateful to him for that. Since 1967, he has presented testimony on life issues to 9 state legislatures. He is the author and co-author of numerous books and pamphlets. Also the author of numerous articles in national and international medical journals, law literature, and publications of the lay press on the important life issues: brain death, organ transplants, and anti-euthanasia and anti-abortion issues, also contrary to the sacredness of life. I can't refrain from just mentioning a few of the titles of his articles. One that appeared in USA Today back in 1984, "Starving Terminal Patients is Murder." Okay, another one, "Help!" exclamation point, "Organs taken from living people." Another one, "Do your organs belong to the government?" Vital questions. Crucial issues in our ideological war against the culture of death. Dr. Byrne has appeared on numerous occasions on national television, opposing Dr. Kevorkian. Thank you, Doctor, for opposing Dr. Kevorkian on Crossfire, a guest on Good Morning America, public television in Japan, and on the BBC program, Are the Donors Really Dead? He's also the author and producer of the film Continuum of Life. And as if that was not enough, he was invited to be a presenter at the Vatican's Symposium on Brain Death and related topics. Apparently, Pope John Paul II, shortly before he died, wanted to get a grasp of actually what was being said about this issue here of brain death. And Dr. Byrne was invited to the Vatican to present the case. Tonight's topic will be Affordable Care Act, euthanasia, brain death, and organ transplants. And so we'll let Doctor go through with his presentation. I think the best thing to do would let him to go along. Just if you have a question, remember it, and then at the end of the presentation we'll have sufficient time for question and answers, and we'll have people line up at the microphone. So it is our great pleasure and an honor to welcome back Dr. Paul A. Byrne. Dr. Byrne.